Jello also there. Now, Africa has some of those low levels of immunisation. Approximately 1 in 5 African children don't receive any vaccines. Outbreaks of measles, polio, yellow fever and diphtheria are on the rise in previously protected communities. It's estimated, in fact, that 33 million children will need to be vaccinated before 2025 to put the continent back on track to at least 2019 levels. And that was before the COVID-19 pandemic. Joining me now is Dr. Freddy Nkosi, who is in Kinshasa. And Dr. Freddy is the DRC Country Director at VillageReach. Thank you for joining us here. In the DRC, what sort of challenges have you been dealing with?
Yeah, thank you very much. I would say, in general, African government, they've done so much, including their partners, to improve immunization services, but the challenge still remains. You just said 33 million of children need to be vaccinated before 2025 in the whole African continent. That is huge. This is the same situation we're living in DRC, where we have a big number also of children who are whether not vaccinated or under vaccinated. Those are the challenges. And of course, a COVID pandemic has also some impacts on affecting vaccination confidence among the parents, among the community. So those are the challenges we are also facing in DRC, like in many African countries.
How do you overcome? I'd like to go back, mention the last challenge you mentioned there, vaccine hesitancy. How do you overcome that?
At the beginning, I would say with COVID vaccination, there were vaccine hesitancy across the country, but the more we sensitized the government and partners, boosted the sensitization campaign, very slowly we start seeing a vaccine confidence, and people start again trusting and believing in vaccination, and parents, they start bringing back their children to get vaccinated. But we are still lagging behind from those who are not vaccinated in the midst of the COVID pandemics.
I just want to bring up the point of infrastructure and accessibility. That was always a problem, wasn't it? I mean, does that still remain a problem, despite the fact that many children would have been vaccinated before the pandemic?
Yes, a country like DRC, as many African countries, where we see the health systems still struggling to consistently reach population, especially communities living far from the big cities or underserved communities, because of many constraints such as a travel time or distance to the health facilities, limited financial resources, lack of internet access, conflict and security, and low health literacy. Those are among the factors we are affecting the whole system and the vaccination activities within the country. But also I have to mention many health systems do not have a way to systematically measure and understand the diverse needs and preference of these underreached communities, because we are still seeing we have a one-size-fits-all health systems without taking into consideration what are the real needs of some specific communities, women, children living in the villages.
Doctor, I wonder if you could, just because we're running out of time, very quickly give me a specific case study. The DRC has had specific experience, and I would like to think of lessons learned. You've had to deal with Ebola, for example, obviously the COVID-19 pandemic. What have you learned when it comes to reaching those communities and vaccinating them as well? What is the one lesson you've learned?
I will mention the first one, centralize planning and coordination to make sure like the processes are implemented across the board. And the second one, you need an essential logistics operations and micro planifications. Without a robust logistics operation, you cannot reach underserved communities. That's where we have been working side to side with the government to strengthen the supply chain system to make sure vaccines and all other health products get to the population where they need them and when, and affordable price and accessible to all the communities where we stay.
Sorry, we've run out of time. Such a huge subject, but I'm going to thank you for your time, Dr. Freddy Nkosi in Kinshasa. Thank you very much.
Thank you very much.